when we think about what's happening up in the brain of the mother, how are these hormones actually doing brain stuff? So when people hear the word estrogen, this is really a class of compounds. But when you hear estrogen did this, typically people, what they really mean is estradiol. That's sort of the major estrogen that gets talked about. So you got estradiol, you've got progesterone. They are changing throughout the pregnancy, but roughly speaking, they're going way up and then they're coming back down later at the time of birth. The absolute levels and the relative levels of these things matter. And then estradiol and progesterone, these are the things that wax and wane, not maybe as much, but throughout the menstrual cycle. And they're what we find in hormonal birth control as well, right? But when we think about what's happening up in the brain of the mother, how are these hormones actually doing brain stuff? How are they getting into the brain? And where in the brain are some of the key sites of interaction where you've got plasticity happening and you've got a rewiring of the mother's brain that's preparing her for her maternal care behavior that's coming up?
Yeah, that's a great question. So estradiol and progesterone are primarily produced in the ovary, but they are what we call steroid hormones, which means they're fat soluble. They travel throughout the blood. They easily cross the blood-brain barrier, and really they can be orchestrating changes throughout the brain and the body.